On this episode, we attend an obesity summit in Montgomery County, Maryland. Then we learn about the Eat Well, Be Active partnership. Finally, we drop in on the White House Conference on Aging. Stay tuned.
We're at the Montgomery County Agricultural History Farm Park talking with Linda Goldshaw. What's been going on at the conference center here this morning?
Our conference today is about ending obesity in Montgomery County. So we've had lots of speakers, a couple of panels, and it's all about talking about the challenges, dealing with preventing and eliminating obesity, and some of the solutions. So it's been an exciting day.
How big a problem is obesity in the county?
It's huge. It's a global problem within Montgomery County, or like most places, there's pretty much close to 2/3 of adults are overweight or obese. And in our young children, we're seeing as many as 33% in our WIC population, overweight, toddlers. So it's a huge problem.
What are the health implications of having that many people overweight and obese?
The health implications of obesity are related to all the chronic diseases: heart disease, diabetes, cancer, stroke, etc. I mean, these are real serious chronic diseases that many adults are living with now. And with the obesity rates going up in children as well, we're seeing chronic diseases start very young.
What sort of people are here at the conference today? Who came?
We have lots of interested parties here today. Our Eat Well, Be Active partnership is one of the sponsors of the Ending Obesity Conference, and that is a partnership within the Healthy Montgomery, which is geared towards creating a healthy lifestyle for all Montgomery County residents. The partners that we have on our Eat Well, Be Active partnership include all of the local hospitals, many private and public organizations. Certainly our Department of Health and Human Services is involved. We have Kaiser Permanente is a great sponsor for us. There are local organizations such as CHEER and the Parent Encouragement Program. I'm afraid to start listing some because then I will forget others, and that would be unfortunate. But it's a great collaboration of interested private individuals and organizations.
And if you're worried about children, more overweight children than used to be, who do you bring in to try to address that part of the population? Is it the school system, pediatricians? Who do you need to be part of this?
All of the above. And we do have Montgomery County Public Schools is definitely a part of Healthy Montgomery and the Eat Well, Be Active partnership. They are working in the schools, and we are working with them. Hopefully, we will start school wellness councils in some of the local schools. But even within the county school system currently, I mean, they are doing a lot in terms of nutrition education and physical activity with the curriculum in the schools during the day and before and after programs.
Now, you get everybody here for the day. They go home with new ideas, new energy. What do you hope will come out of this conference over the next years that'll, the people will be doing to, move us towards healthier lifestyles?
Yeah, that's it. It's all about action. It's not about just sitting in a conference. We are hoping that this provided the opportunity for sharing and networking. And through the Eat Well, Be Active partnership, we are hoping to find grant funding so that some of the recommendations of the partnership can actually be put to fruition. I mean, in the background, without any funding and without any staff, there are certain things we can do, such as working with the schools, and such as in community clinic. One of our partners is activating a project called Physical Activity as a Vital Sign. So there are some things that you can do without money, but generally speaking, we have to find funding, and then we will pull these partners back in when we get the funding and we know we have money to work on projects.
And you mentioned, the one project that's going on, the physical activity is a vital sign. What is that?
That is basically when a person goes to see their healthcare provider, they are actually asked about their physical activity level. So it is being asked about, just as a clinician will come in and do your temperature and your blood pressure, they're going to ask you about physical activity. And it will be marked in the record. An inadequate amount of physical activity goes in as a health code. So the patient will understand that their doctor is concerned about this enough to ask, and if it goes in as a health code, that's providing us with the data. We'll be able to actually see if we see any improvement in these obesity rates. When people are directly told by their doctor, you really need to ramp it up a little bit.
Are there any new ideas on how doctors can encourage their patients to be more physically active?
We just had one presenter, Dr. Czar from Washington United Health Center. He is actually working with the National Park System, Park Service, I guess I would say. And they are mapping the assets of all the parks. And his project would include doctors pretty much being able to, through the health records, put in a person's zip code and get a park page where they could actually hand the park page to the patient and say, this is the park in your area, find something that might interest you and go and get your physical activity there. So those are the little things. We've been told that, and fully understand that doctors don't have enough time within their 15-minute appointments to really counsel on overweight, eating, physical activity. But there are small steps where we can bring it to the forefront and make patients understand the importance of it.
Obesity trends have been going all the wrong direction in recent decades. Is there light at the end of the tunnel, or is you going to be able to turn it around? What's there positive out there to look at?
Well, it's just will. It really is. It can be turned around. We've gotten this bad in 20 years, so it shouldn't take that long to reverse it. I think there's much more talk about obesity prevention and the realization that it's really destroying us in terms of health, the economy, the security impact. There's so many ramifications of obesity that I think there's a greater will. But those of us on Eat Well, Be Active, we really realize that so much of this has to be done as a policy level. And that's where we need to move towards, changing policies at workplaces, changing policies in the healthcare system, changing policies in schools, where people have easy access to healthy foods and physical activity, and the whole culture is changed towards living a healthy lifestyle and wanting to live a healthy lifestyle, and really rejecting the things that have gotten us into this, position with the unhealthy foods, the fast foods, the marketing. It's so many facets.
We're talking with Linda Ashburn, who's co-chair of Eat Well, Be Active. What is Eat Well, Be Active?
Eat Well, Be Active is a partnership with the aim of either reducing or preventing obesity in Montgomery County.
How did it get started?
It got started as a result of work from Healthy Montgomery, which is the local health improvement process of Montgomery County. They are charged with identifying health concerns in the county and trying to figure out how to tackle them. They identified obesity as one of the major health concerns.
And it talks about eating and being active. Are both of those important for tackling the obesity problem?
Yes, they are. We have decided to take a multi-pronged approach, a two-pronged approach, and we've done literature reviews, and we found that definitely both physical activity is important as well as healthy eating.
So how'd you get started then?
Yeah, so it took us a while to figure it out. We got started doing the literature reviews and trying to understand what other jurisdictions had done to tackle the problem of obesity. We know obesity is a problem everywhere in the country. And there's been a lot of really good work. The CDC has childhood obesity demonstration projects, so we can learn from those. Robert Wood Johnson Foundation has done a lot of great work. Institute of Medicine has, I believe it's called the Obesity Solutions Panel discussions periodically. So we just looked at all of that to help to inform what we were going to do here in Montgomery County. Montgomery County is a unique population, a very diverse population, high immigrant population, so we needed to think a little out of the box, take what we can learn from everywhere else, but adapt it to our own setting. So what we did was we decided we needed to think very broadly, get a lot of folks involved because it is a multifaceted problem. So we couldn't just stick with our health folks. We needed to expand and go to all kinds of community organizations, grocery stores. Everybody needed to get involved. So we decided to develop this partnership with a very broad base. So we have about 80 different people representing lots of different organizations from, like I say, grocery stores, schools, all kinds of organizations. So that's how we got started, and then we decided that the best approach was to look at a particular community, and because community level approaches seem to work better than trying to work with the whole county as a whole to start with. So we picked a part of the county to pilot test. And so we picked the Long Branch, Silver Spring area and Tacoma Park, where they kind of meet together there. Just to get started to test out some of the strategies to see if they would work.
And when you look at the Long Branch, Tacoma Park community you started with, what are its characteristics, the demographics and so on?
Yes, well, it does have demographically, it has a high immigrant population. And also, the county had previously identified that part of the county as one where it looked like, based on hospital statistics mainly, that there were more health concerns and more poverty in that area. We looked at in a county in Washington, they had done obesity prevention work, looking at schools with high free and reduced price meals, a high percentage of students that were getting free meals at school, which is sort of a proxy for poverty. And they did obesity works in the communities around those schools. So we identified 3 elementary schools in that area that had high, what they call farms rates, high percentage of students with those getting free meals. And that helped us kind of, locate a place where we could start.
When you go out, and work with a community like that, you talked about the large number, 80 different people involved. When you approach them and say, we want to tackle the obesity problem, do you get a lot of people going, I'm not a health department, why should I care? How do you talk to people?
Yeah, that was a real challenge and something we really, for me, was kind of exciting because I worked in public health for a long time, and I thought, okay, how do I go to somebody who's working in a whole different field, say a planner from the Department of Planning? How do I approach that person and say, we want to talk about obesity, And so it helped a lot to review the literature to see how does the impact of the way the community is designed, for example, how does that impact obesity? How does what people find when they, in their community, from convenience stores and grocery stores, how does that impact obesity? So looking at the setting was really important, and it helped us to have those conversations. So what we decided to do was to break down by setting or place into work groups. So we had a work group focused on schools, a work group focused on healthcare settings, another one focused on childcare and home environments, and the other one was focused on community, which was kind of meant to be sort of outside in the community, businesses, just community-based organizations, anything out in the community. So we decided to structure ourselves that way into those working groups. And that helped because then people come together because that's the setting where they work.
So what lessons did you learn from that pilot project you did? Would you choose the same 4 groups if you did it over again, or what, where did you see success? Where did things not quite work out for you?
That's a great question, and I'm happy to say we learned a lot. I think to answer your question, yes, I would choose those same working groups again. I think that was a good way to get people involved, and also you're bringing experts together who work in that setting so they started out at a higher level conversation because they already knew what they were talking about. There was one work group I would say that I would definitely add, but we couldn't quite figure out how to make it work, and that was as workplaces or work sites. That was originally intended, we wanted to have a working group and we just couldn't quite get it all together and support it. We really don't have a lot of funding for this, so we're kind of, 4 working groups was about all we could handle. So that's one thing. The other thing, though, and I'll give an example of the school working group. They decided each of the working groups was charged with coming up with an action plan, and so each one came up with some type of intervention, whether it be policy or systems change or programmatic intervention, to tackle. And the school working group decided to do school wellness activities in the 3 elementary schools that were the pilot test schools. They had some success in one of the schools, but the other 2 schools, they found that it was very difficult to get things started. The PTAs weren't always very strong. They kind of had a hard time. And I think, again, we're looking at schools where parents are probably working extra jobs. I mean, it was just hard to get people excited about doing something else in addition to what they're probably already trying to do. So we went back to, and Healthy Montgomery has a steering committee, which is made up of high-level stakeholders in the county. We went back to the steering committee and said, look, we tried this pilot test with these schools, and what we found was certain schools really need, and particularly these are the high-risk schools, need additional support. So we were able to get the steering committee member who is from MCPS to say, okay, we're going to form a countywide wellness council or countywide wellness effort. And based on that, we'll try to support Eat Well, Be Active, and Eat Well, Be Active in turn can try to provide some resources and some support to those individual schools. But again, based sort of with the county structure and supported countywide.
Okay, so on the school side, you're going countywide. What's going on going countywide with the program in general? What are your ideas on what might happen next?
Yeah, so we did a sustainability plan to try to figure out how do we keep this going? How do we expand? Where do we go from here? And a couple things that we decided to do. We have a coordinating committee, so we kind of put our heads together in a smaller group to try to figure out what direction to go next. So we decided we wanted to look for funding. So we got a donation from Kaiser Permanente to hire a grant writer. That's going to go through one of the nonprofits that's affiliated with Healthy Montgomery. And we're going to try to get some funding for a coordinator for the program. So that'll help coordinate things at a county level. The other thing that we're doing countywide, we are, some of the things so for example, the healthcare work group is looking at a strategy in the healthcare setting called Physical Activity as a Vital Sign, where they are incorporating screening questions on physical activity into their vital sign, their routine vital sign assessment. So every time somebody comes into the clinic, they get their blood pressure taken, they get their heart rate done, like they always do whenever they come in the clinic. They're also now going to be asking them 2 screening questions about physical activity every time. So that just keeps reinforcing the importance of physical activity. They are implementing that. CCI, Health and Wellness Centers, has taken that on as to test it out. And they're implementing that in 3 clinics, and they're not all in Tacoma Park and Long Branch. One is also in Gaithersburg, and the other clinic is in Greenbelt, which is in PG County. So they have 8 sites in Montgomery and Prince George's County, and those are the ones they selected to pilot test this. So to a certain extent, we're even going a little bit regionally.
So it's, I guess, fairly common. You're doing something new. You want to try it on the, a pilot, a small level before I guess it's less painful to make mistakes and do your learning on the small level. Now, when you go countywide, this is very much community based in, where you started. Would you be trying to think of the county as a collection of communities when you go countywide, or how do you handle taking something local and focused and get it countywide?
Yeah, that's a great question, and I think you're right. That is kind of the thinking as we were reading about obesity and the way it's been handled in other jurisdictions. It's one thing if you're a small city. And it's another thing, a place like Montgomery County with such diversity amongst its various neighborhoods, if you will, or communities. But I think the strategy is to find a method or a technique that can be applied anywhere. So I'll give an example. As part of the physical activity as a vital sign effort, one of the things the healthcare providers had requested in our discussions was to have resource information about local physical activities that they can give out to the clinic patients. Those resources, if you live in Gaithersburg, you can't give them a rec department resource down in Long Branch. So these are people who generally, the clinic patients don't have transportation often. So, and even if they did, I think people mostly want to find resources within their own community. So we have come up with resource listings for the 3 clinics that are pilot testing this physical activity as a vital sign. And they're all done the same way, the same resource format, if you will. But they're all local resources to each of those areas. So we can do that anywhere in any community. So we're kind of trying out ways to do things that we can apply the same strategy, same technique, the same method anywhere to any different community.
One overarching thought that I want to share, though, is that in order to create better health for our aging population, I believe it's essential for us to build a culture of prevention in America. We spend a lot of resources and time investing in treatment, as we should, because we have made extraordinary advances in treatment. We have many people who suffer from illness who need those advances. As a physician, I myself have been part of delivering so much of the benefit that has been accrued through years of research to patients at their bedside, and I'm very grateful to have had that privilege. But while we invest a great deal in treatment, we don't invest nearly as much in prevention, in ensuring that we are as good at preventing illness as we are at treating it. But this is actually, I believe, what we're called to do now, particularly, although not exclusively, for our aging citizens. Now, you can look at some of the measures and think, well, we're doing a pretty good job already. 75%, for example, of older adults feel that their health is in good, very good, or excellent shape, and that's good. But what I worry about is that we have the potential to slip in these statistics and to go backward because of some really concerning trends, because of the very high rate of obesity that we have in this country, because of the extraordinary rate of chronic disease that we have, with almost 1 in every 2 adults being impacted by some sort of chronic illness. We also have significant problems in terms of our trend in physical activity. Only 50% roughly of adults get the amount of physical activity they need every day, every week, every year. And that number is around 25% when it comes to adolescents. So these are concerning. But I believe that the way to overcome some of these concerning trends, the way to build the foundation for a stronger America, is to create a culture of prevention that has 3 pillars to it. Those being strong and healthy nutrition, being physical activity, and also being emotional and mental well-being. We have to build and support and sustain those pillars if we want to really create a culture of prevention. But part of this work is structural work. And as the mayor mentioned, there are important things that we can do in our communities in terms of how we build our neighborhoods to make them more amenable to physical activity and to make them safer as well. How we make food accessible and affordable to people, nutritious food in particular. How we make mental health care services available, but also how we build in a culture of emotional well-being from the earliest days in school itself. These are all structural changes that we can make in our neighborhoods and our communities that are essential. But structure alone is not the solution to building a culture of prevention, because what we also have to do is we have to change norms. We have to change norms such that healthier choices are not just easier, but they're also more desirable. The analogy that somebody gave to me once is they said, if I approached you with a cookie in one hand and an apple in the other, such that you had no barriers to access and both were free, what would make the decision of the difference between which choice you made? Those are often driven by our beliefs, our practices, the things we see around us. And that is why it's actually so essential for communities and local leaders to be involved in creating this culture of prevention. Because culture, as much as we might think is the case, does not get generated from Washington, D.C. or from the top down. It gets often generated very locally. And as I've traveled, I've seen actually very interesting examples of how local communities are shaping cultural norms. When I went to Birmingham, Alabama, I met with a pastor there of a very large church who said that he made a decision with the other church leaders to change what they offered in terms of food every Sunday. And they made one simple, well, I shouldn't say simple, they made one very difficult for them transition, which is to go from fried chicken to baked chicken. And they said, and he told me, he said, look, I'm a son of the South, and I grew up on fried chicken, and this was extremely difficult for me to swallow. But he said he did it, and about a month in, he thought, this baked chicken tastes pretty good. And it turned out that when I came there, which is probably a year or more later after they started this program, everyone was eating baked chicken there, at the church on Sunday, and a lot of people, including him, had actually changed what they were doing at home. So we can change norms and culture and practices based on what we do in our neighborhoods. And that's actually, I believe, what we're called to do right now. And I'll mention one last point, which is to recognize how important it is for us to build this culture of prevention, particularly for our aging population.
Visit us on the internet at www.pedestrians.org.
We need to recommit ourselves to finishing the work that earlier generations began. Make sure this is a country that remains one where no matter who you are or where you started off, you're treated with dignity. Your hard work is rewarded. Your contributions are valued. You have a shot to achieve your dreams, whatever your age.